Welcome back. Now, do you get regular checkups at the dentist? If not, why not? Well, 1 in 4 people are said to be so scared of going to the dentist that it's increasing their chance of tooth decay and stopping them getting vital treatment. Well, it's a subject that we can really get our teeth into, and so joining me now is dentist Mike Gow, who deals with dental anxiety management, and Jade Lazar, who's managed to overcome her fear of the dentist chair. Welcome to you both. Well, Mike, first of all, you know, you've seen a lot of patients come in with this sort of anxiety. How have you dealt with it?
I think for me, one of the main approaches is that there are many approaches. There's a great quote from a psychologist back in the 60s who said, if the only tool you have is a hammer, then every problem begins to look like a nail. So for me, it's a mixture of building trust and rapport, combined with the variety of clinical techniques that we have and things like hypnosis and conscious sedation. Now, as a nation, we hold a lot of unenviable health records. What's the general state of our teeth? The good news is it's actually improving quite a lot, and over the last 10 years we've seen great improvements in Scotland and in Glasgow. The number of adults, for example, who have no teeth at all has decreased from 11% from about 20 years ago to about 4% now. And in children we're looking at the statistics being about 70% are caries free, so no decay in their mouths. Going back 20 years that was about 40%, so there's been some real improvements.
Now, I think most people would probably admit to having a slight fear of the dentist. I'm definitely one of those. But what's the difference between that and someone who has a proper phobia of going?
There's different words that are often used. The word anxiety often is a kind of ill-defined sense of uneasiness about something. A fear is something that's quite specific, so you know exactly what it is you're fearful of. Whereas a phobia is defined by a fear to a degree that leads to avoidance behaviour. So you stay away from the thing that causes the panic or the fear, and it's often an exaggerated response. So the actual response is greater than the threat of the thing.
Now, Jade, you were in a similar position. You had a bad experience as a teenager. What happened there?
I did, yes. So basically, I think I was around the age that I could go to the dentist myself, so I had no parents with me, accompanying me, or anyone overlooking what was happening. And I've been very proud of my smile and going to my previous dentist and getting thumbs up and stickers and all sorts. I came out with 4 mercury fillings, and it was that's a lot to get done at the one time. And that's when I started to lose my confidence in dentists in the first place. And 10 years later, when I was pregnant and I had dental pain, it prompted me to go back, and unfortunately I suffered a bad experience then as well. So yeah, it's been over 10 years actually, a lot of unlucky times with dentistry.
And you can kind of trace those effects back to that dentist visit?
I think I've just been unlucky. And in the 10 years I had one good dentist that I did put my trust in, and I've not met anyone else like that since, apart from Mike, since then. So yeah.
Well, we'll hear more from you in a moment. Now, we all know the importance of introducing good habits at a young age. So let's hear from Primary 3 pupils at Perry Park Primary School in Govan to find out their tips for a healthy smile.
You start with the teeth and work your way around, and then you start with that side, and then you work your way around, and then keep doing it until your time's up from brushing your teeth. If you eat like a sugary sweet, you should remember to brush your teeth after it. I'm not scared at the dentist. It's really fun, and like the dentist because the person who checks my teeth, she's a really nice person. Because if you don't brush your teeth, all your teeth will fall out and you can't chew your food. I feel alright because the dentist usually says to me, just close my eyes and just think of something, and that's what I do, then it's done. I feel surprised that I didn't actually feel it. I think you'd be better drinking healthy stuff and water, and you'd be better eating apples and stuff. And if you eat healthy food, like healthy breakfast, healthy dinner and healthy lunch, it'll be good for you and you'll have really clean teeth.
Well, Mike, some sound advice there. We'll get to the kids in a minute, but talking of Jade, how did you help her get over her phobia?
Well, I think like for many people, one of the biggest things was trust. Obviously there had been some bad experiences in the past, and it was a case of identifying what the main concerns were and building up the confidence over having control over what was actually happening during the appointments, having appropriate information about what was happening. But of course every case is slightly different, as I say, but it's quite a common mixture of things to require that information, the control and the trust being major factors. And
we just heard from the kids there. Would you say the message about having good health for your teeth is just for kids, or should we be talking more about adults?
Well, of course, the message should be for everybody, and I think adults often forget about themselves, especially if they're parents and they're busy getting the children sorted out. But it is so important to be looking after your own dental health for avoiding toothache, avoiding pain and discomfort. Yeah.
And Jade, how would you describe how you feel now about going to the dentist to where you were?
I have to say, particularly at Mike's dentist, I actually look forward to going. But I don't look forward to it because of the feeling I get once I've overcome it. So I never ever thought I'd say that, and it helps that Mike's dentist looks. It's very lovely to be there. It's the best environment for anyone that has any fears. It just caters for any concern, like more time and a nicer environment. They've got kind of images on the ceiling, and it's very relaxed. So.
And as for your own experience, what do you find helps you when you go into a dentist? What are you looking for?
I ask a lot of questions. I have a lot of boundaries, and because of what's happened in the past. And I do like a lot of time. So I do like a lot of time spent, and I need to have a certain rapport with someone before I trust them. So it's a major trust thing with anyone, with a doctor that I work with, or anyone that's that intimate. It's an intimate thing. It's a close thing, and it's, obviously it's a medical thing to a certain extent as well. So that helps me more than anything. Things being explained and a lot of time taken.
And I think it's important to be aware that trust is never assumed either. Every new patient that I meet, I assume that I have to build trust, and there is no trust to begin with.
Yeah.
It's quite an important point.
And Mike, why do you think we are so afraid of dentists?
The vast majority are through bad experiences in the past. However, there are playground stories when you're growing up, things in the media that are portrayed as evil dentists, and lots of different reasons. But the biggest one is bad previous experience.
And your own tips on what people can do to maybe ease their fear of going?
I think the first thing is actually making that first contact, and it's very hard for people to take that first step. One of the biggest boundaries often is a sense of embarrassment. I'm feeling embarrassed about your anxiety and your fear, but also feeling embarrassed about the way your mouth is and how things have neglected over the years. But most dentists don't have any emotional feelings about your teeth. We're here to fix your teeth and get your mouth healthy again, get you smiling again, and get you eating again, and that's the important thing to remember.
And Jade, very briefly, have you scheduled your next dentist appointment?
I do, and now I'm happy to say it's only cosmetic things that I want now. So my teeth are healthy, and I did want to say that the reason I was prompted to go to the dentist was the health of my child. I was pregnant at the time, and I think now, I did neglect myself as an adult, and you do want to be a role model to your children, so we're all kind of healthy, looking after ourselves.
Well, Jade, Mike, thank you so much for coming in, and now we all know much more about keeping our teeth healthy. Now, tomorrow on STV News, we visit a special photography exhibition focusing on mixed-race families. The images, shot over a few months, capture the intimate and special moments between girls and their mothers. We talk to a mum and daughter about impacts that their mixed race has had on their relationship, and hear from the women behind the project. Now remember, you can get in touch with us at STV News. You can contact any of our reporters by email, Facebook or on Twitter if there's a story you want to tell us about. And that's it for the moment. Keep up to date on our website, stv.tv/news. But from all of us here in the STV News team, enjoy the rest of your evening. Bye-bye for now.